Education Secretary Gavin Williamson has declined to give a date for reopening schools in England, denying reports that the government hoped to send children back to class within a few weeks. He insisted the government's tests would need to be met before pupils could return to school as part of any easing of coronavirus restrictions. The latest official figures for the UK show that there were 596 deaths reported in hospitals in the last 24-hour period. That takes the overall number who've died in hospitals to 16,060. Today, the government was again under pressure over the supply of personal protective equipment for healthcare staff, particularly the gowns used in intensive care. A delivery from Turkey that was due to arrive here today is now expected tomorrow. Here's our health editor, Hugh.
A vital consignment of masks and other personal protective equipment arrives from China at Prestwick Airport near Glasgow this weekend. It's ready for distribution to health and care workers around Scotland at a time when the kit known as PPE is in short supply in different parts of the UK. Some hospitals in England have warned they're down to their last few days of supplies of gowns used in intensive care. A plane load of equipment due in from Turkey didn't arrive as expected today. Shortages of PPE have been reported by frontline staff for several weeks now.
We've got is from Hugh.
I raised the issue at the Downing Street media briefing. Can you comment on reports today that stocks of PPE were allowed to run down in the couple of years before the pandemic, and why was more not done to get hold of more PPE in March and early February, including using British companies?
It is important to remember that although there may be elements of distribution problems across the UK at different times and in different places, this is a huge pull on services which we have never seen before. We have managed, actually, despite signalling many potential shortfalls, to continue to supply going forward.
Ministers said they were doing everything they could to bring in PPE from across the globe, but Labour said more should be done to find supplies in the UK.
Every MP's inbox, or certainly my inbox, is awash with small firms across the country saying they've tried to help the government with PPE. They've tried to tell the government they can manufacture PPE, and they hit a brick wall. They don't get anything back from the government whatsoever.
Stephen was a community mental health nurse who'd worked for the NHS for 30 years. He died with coronavirus last weekend. Other members of the family were infected. His daughter made this plea to the public.
Please stay at home where you can. I mean, my dad couldn't and he lost his life. So if you can, I know it's horrible. No one wants to be stuck at home 24 hours of the day, every day. But it's what we need to do right now. And if it saves one life by staying in the house, then it's absolutely worth it.
With social distancing in force and empty streets, speculation and debate about when the lockdown will be eased intensifies. There have been reports today that some schools might reopen in the middle of May.
I want nothing more than to see schools back. Get them back to normal. Make sure that children are sat around learning and experiencing the joy of being at school. But I can't give you a date.
And at the new temporary Nightingale Hospital in London's Docklands, their first patient to be successfully treated for COVID-19 was moved to another hospital to continue his recovery. There was applause from the staff who volunteered to move to work there. Hugh, BBC News.
Well, in normal times, children would be about to go back to school at the end of the Easter holidays, but now the emphasis is on online content and trying to make sure of provision for disadvantaged children and those without access to technology. Our education editor, Branwen reports from Staffordshire.
The streets in Stoke are empty. The schools in England are closed. But for how much longer? Carl Ward runs 4 schools and a college. He doesn't expect to reopen them soon. And when they do, it won't be back to normal.
I think they're going to be part-time. There's certainly not going to be a moment where all children come back to school together. We're going to have to take into account the health and safety of staff. That's going to be really important as we look after children. Social distancing will have to be considered. There have to be plans going into that, as schools have done so far with quite a few less students, obviously, than they've been used to.
Ministers know that parents have to be convinced their children would be safe coming back to school, and teachers confident that they wouldn't be risking their lives by coming to work. That's going to take weeks and weeks of planning to come up with a strategy that everyone can trust. For parents, it is challenging, with the worry kids are missing out on learning.
I think we've got to put the safety of the students and the safety of the teachers and other staff that are working in schools first.
I think it'd be very difficult to space the children out. I mean, children don't space themselves out. They're together, aren't they, really?
Yeah. Teachers also say it's important for everyone schools are safe.
We aren't just worried about teachers and other staff in school. We're worried about the children and their families. Children will be going home from schools to households with vulnerable adults and other vulnerable children in them.
If you select on it and open up the document...
Weeks ago, schools got ready to move online. Some are lending laptops to poorer pupils. Now the government is promising to do the same.
It's a little bit funny, isn't it? It's the beginning of the summer term and we aren't all in our own schools.
A new online school is launching, backed by some big academy schools in England. But this new digital world of learning risks leaving some of the poorest kids falling even further behind. Branwen Jeffries, BBC News, Staffordshire.
More now from our health editor, Hugh, whose report you saw a moment ago. Hugh, we had another milestone passed today in terms of the number of people who've died with COVID-19 in hospitals. What do you make of the latest figures?
Well, Mishal, shocking though it may seem, the latest daily reported death toll was below 600. And if you think it was nearly 1,000 10 days ago, things do seem to have moved in a different direction. And at the Downing Street media briefing, it was said to be a relatively positive trend. Of course, these are hospital deaths. They don't include deaths in the community. Those are published in separate figures. In terms of patients in hospital with COVID-19, there were more figures published today at the briefing, and we can have a look now at the way things look on that particular chart. And you can see there in London, the number has come down quite sharply. London, of course, was where the caseload first began to pick up a few weeks back. In the northwest, though, case numbers have spiked up. Scotland and Wales, they are relatively flat and plateauing, and that was the word being used in the briefing. Now, it's worth remembering as well that we were told a few weeks back that the peak in terms of demand on the NHS was expected this particular week, and there has been spare capacity. The NHS has coped reasonably well, although under a lot of pressure. That being said, Jenny Harries, the Deputy Chief Medical Officer for England, did make clear if social distancing is not properly observed, then there could be a second peak, and that's what they want to avoid.
Hugh, thank you very much. Well, on that note about the politics and the policy of all of this, let's join our chief political correspondent, Vicki Young, who's in Westminster. How are ministers dealing, Vicki, with the question of when and how these restrictions on our lives could be eased?
Well, there's been so much speculation, particularly about schools, but it's a very blunt answer there, wasn't it? There is no date, and it certainly doesn't sound imminent that schools might be reopened. Ministers very much sticking to the script that it's too early to talk about all of this. They don't want to dilute that stay-at-home message. They're waiting for more scientific data. But it was fascinating listening to Michael Gove today. He said that the UK was taking a deliberately cautious approach. So while other countries are starting to move, it sounds like ministers here will watch and see what the impact is, and there is very real concern, including from the Prime Minister, about the possibility of a second wave of infections and, of course, a second peak of deaths. Now, the next review into the lockdown measures isn't until the 7th of May. We may not hear much detail before then, even though there are cabinet ministers who are pushing for more to be said in public to explain to people what might be coming next. And I think when the time does come, we should expect really gradual modifications of the rules in some areas rather than an overnight return to life as normal.
Vicki Young, Chief Political Correspondent, thank you.